Welcome back, ladies and gentlemen. As promised at the beginning of the episode, we're going to be shedding the spotlight on certain diseases, and of course we're going to be talking about the Egyptian role in the health sector in Africa. As you know, Egypt has always played a prominent role in Africa, of course in Egypt itself, with taking the health sector into another direction of development. And in this regard, we're going to be speaking to Dr. Amal Kady, the dermatologist specialized in autoimmune skin diseases. Also, she's a member of the Euro Academy of Dermatology and Mineralogy, an expert in clinical drug development and medical affairs in the United States. Good morning to you, Dr. Amal.
Good morning, Lubna. Great pleasure to be with you here today.
It's an honor having you with us, Dr. Amal, on Nile TV International. So let's start with understanding the Egyptian role in Africa and the kind of conferences that you may give us an idea about, and how Egypt has played a significant role, and then we move forward to the kind of diseases that maybe we can help people understand better and how they can avoid it.
Right, so certainly Egypt plays a pivotal role in healthcare in the region, not just in the continent of Africa. I'm a graduate of Kasralani Faculty School of Medicine, and I specialize in autoimmune skin disease, and this is what I would like to focus today on: raising awareness about autoimmune skin disease. What are these diseases? Who are more susceptible to developing autoimmune skin disease, and specifically focus on vitiligo, which is one of the most challenging to treat autoimmune skin disease. In terms of the latest conferences in Africa, in fact, soon this month I will be flying to South Africa to give lectures on autoimmune skin disease such as vitiligo and alopecia. As an Egyptian dermatologist working in pharmaceutical drug development as well as autoimmune skin disease in the USA, I'd like to shed light on autoimmune skin diseases and discuss with you who are the most susceptible people to developing autoimmune skin disease and what are these diseases.
Okay, so Dr. Amal, as you say, autoimmune skin diseases, skin diseases in general, they're quite tricky. And when it comes to autoimmunity, it becomes even more tricky because you cannot really understand or control the spectrum of autoimmunity. And I think you should tell us more about the part with skin, because autoimmunity can be involved in many other diseases, but how does it work in skin diseases exactly?
Yeah, that's a great question, Lubna. So let's start by the definition of autoimmune skin disease. What are they? So autoimmune skin diseases occur when the immune system mistakenly attacks the healthy skin cells, leading to inflammation and tissue destruction, as well as resulting in visible skin lesions. Some examples of autoimmune skin diseases include psoriasis, which has a high cell turnover rate and scales, as well as alopecia areata, hair loss, vitiligo, pemphigus vulgaris, systemic lupus erythematosus, and many others.
Seborrheic dermatitis.
Seborrheic dermatitis is one of them as well. Yes. So today, focusing on vitiligo. Vitiligo is a chronic autoimmune skin disease that occurs when the immune system starts attacking the melanocytes. These are the cells responsible for the natural skin color and the pigment. Each one of us has a unique type of melanocyte that gives us different skin tones. And so when they are destroyed by the immune system attack, chronic inflammation ensues, and that results in the loss of pigment, which can start as early as small pale spots on the skin, most likely in the sun-exposed areas such as the face, the hands, or the feet.
So why exactly does the immune system does that? Like, why does it attack its own cells?
That's a great question, Lubna. So there are multi-factors. We call vitiligo, such as any other autoimmune disease, multifactorial. So there are genetic susceptibilities. Some people are genetically more susceptible to developing vitiligo than others, and that's why when there is a family member, when there's history of family family history of vitiligo, this makes the individual more at risk or susceptible. Also environmental factors, oxidative stress, exposure to some toxins, some chemicals, some medications, and also severe emotional stress. We've done studies, over 10,000 patients of vitiligo in the USA, and we found in many cases there has been a major life event that triggered vitiligo or worsened it. So they have to be susceptible, plus environmental exposures, and then stress or certain infections. It's not just one factor, it's multifactorial.
Well, those are for like the statistics for the United States. How about in Africa? What are the most common autoimmune skin diseases in your research that you have found?
So that's another great question, Lubna. So in Egypt and within the Mediterranean and northern African regions, vitiligo is common. And in fact, I'll tell you something interesting that many of the viewers might not know, that the ancient Egyptians were the first people to diagnose and treat vitiligo.
Wow.
And this was found in one of the most important papyruses. It's called Ebers Papyrus, over 2,500 years old, where more than 300 conditions, medical conditions, were described. How did the ancient Egyptians treat vitiligo at that time? They used a mixture of oil, honey, and tar. The Greeks used volcanic ashes with olive oil and honey, and the Indians used certain plants mixed with honey and other ingredients.
Those things actually treat vitiligo?
They help a little bit, but of course, to find a definitive treatment, in fact, now there is two approved treatments. One of them is FDA approved, and I personally worked on the launch of this treatment during my tenure at one of the global pharmaceutical companies in the USA.
Okay.
It is a topical JAK inhibitor, but I'll pause here for other questions. But back to your question, so vitiligo is one of these. Also, we have psoriasis. It's common in Egypt and the region, lichen planus, pemphigus vulgaris. So within Africa, these are also common, and also vitiligo is common in South Asia. It can happen to anybody at any age, but most commonly before age 30. And I'll pause here for other questions that you may have.
All right, so there's a common misconception, or maybe it's not a misconception, there's a common idea about autoimmune diseases that it can never get treated. You can only control the symptoms, but you can never actually get rid of the disease itself. So how can someone with an autoimmune disease work on that, and how can they work around and build their life around having an autoimmune disease?
Great question, Lubna. So most autoimmune diseases are either chronic or recurring. Recurring meaning they flare and relapse, such as eczema, atopic dermatitis. Psoriasis also flares and relapses, lupus flares and relapses. Are they chronic? Yes, they are. Many of them don't have definitive cure. However, there are treatments, meaning we can control the disease, we can manage the symptoms, and we can reach levels of remission. So for psoriasis, for example, there are advanced treatments such as biologics, whether topical or oral or injectables, where we can control the disease and achieve 100% skin clearance. In vitiligo, there is no cure, but there are treatments. So one of the first and only treatments that have been approved by the FDA in 2022, and I worked on launching that treatment. It's a topical JAK inhibitor, it's a topical biologic, and it achieved repigmentation rates greater than 90% for the face and other body parts, which is great. Recently in Europe, another systemic JAK inhibitor has been approved in Europe for the treatment of vitiligo, and it's an oral pill. How can the patient live with it? It's very important. Number one, awareness, managing the emotional and physical stress, seeking a dermatologist who is experienced in autoimmune skin disease, because not all of us dermatologists focus on autoimmune skin disease.
Yes.
So you want to go early because early, timely diagnosis, accurate diagnosis by a dermatologist saves a lot of time, and also starting the treatment early. And if someone has vitiligo lesions on areas that are hard to repigment, such as the hands or the feet, they must start treatment very quickly because those areas are resistant.
Is it reasonable to transition to bleaching the skin?
Bleaching would be a last resort if all else failed, and this was adopted by people prior to the FDA approval of the vitiligo treatments.
Okay.
And so it would be in certain limited cases and would not be the first line of treatment. So early, timely diagnosis, starting treatment early, and being consistent. I'd like to send a message to the people living with vitiligo and their clinicians and dermatologists. Start the treatment early, get the accurate diagnosis, and be consistent. Take the treatment as prescribed by your doctor and be consistent, because even if you reach 100% repigmentation, don't stop, because the patients who stop the treatment, they have a 40% chance of relapsing in the first year of stopping treatment. So it's just like diabetes. If someone has diabetes and their blood sugar is well controlled, they're not going to stop the treatment. You have to continue to take the treatment. Also, it's very important to acknowledge and address the mental health aspect of vitiligo, because in our studies we found that patients with vitiligo, they're more likely than others to have anxiety, depression, social stigma, and many other factors that we can focus on. What are the challenges and the disease burden for people living with autoimmune disease such as vitiligo, because it's visible. And one misconception, to your point, is people mistakenly think that autoimmune skin disease or disease like vitiligo is contagious. I've had patients come and tell me that
that's very wrong.
Some people were worried to shake hands with them because they thought it's contagious. So my message to all our viewers, autoimmune skin disease is not contagious. Vitiligo is not contagious. It's an autoimmune disease. Psoriasis is not contagious. So you're not going to catch it by living with someone who has vitiligo or shaking hands. Also a message to the community, please be thoughtful. Don't stare at someone's lesions, because they face this battle every day.
Yes, and it only reflects back on their mental health. Dr. Amal, I would actually love to talk hours with you about this. As someone with an autoimmune disease myself, I would actually love to speak a lot longer with that, but unfortunately our time has wrapped up, so thank you very much for your insights about autoimmune diseases. We had the absolute pleasure to speak to Dr. Amal Al-Kady, the dermatologist and physician specialized in autoimmune skin diseases, member of the Euro Academy of Dermatology and Venereology, expert in clinical drug development and medical affairs in the United States. Thank you once more, Dr. Amal.
Thank you so much.
Thank you everyone for watching this segment.
Great pleasure being with you.
Thank you. Stay tuned, ladies and gentlemen, and let's go for this short break.